Often a loved one is experiencing a mental health challenge, and it can be tricky to know what to say or how to help. Julie Meyer is back with us. She's the director of ThedaCare Behavioral Health. And Julie, today we're going to ask you to maybe react to some scenarios, explain if that's the right way or wrong way to react in that situation. All right, let's take a look at the first one.
I noticed you seem down lately. I know a guy who knows a guy who took a psychology class in college, if you're interested.
Okay, so what's your reaction to that if somebody is coming up with that?
I appreciate that they asked the question, right? Being there is so important and really 99% of it. But we have trained behavioral health professionals that we can connect individuals with. And I would always recommend going through your primary care provider to getting connected with the right behavioral health provider.
All right, let's listen to the next one.
Did you switch your coffee to decaf this morning? Because you seem a little off.
Well, coffee is really important to all of our routines. I do understand that. However, relying or talking through using any sort of substances about our behaviors, especially when you're not a professional, wouldn't be my advice. But I would also add that if someone you love is seeming down or not acting like they usually act, or maybe not quite as happy as they usually are, they might be experiencing some depression. And I think recommending that they talk to a provider or professional would be the right approach there.
I wore my spandex today because I'm your superhero. How can I help you today?
You know, actually, I think that's a great lighthearted approach to start a conversation, but also realizing that you probably can't solve all of a person's problems is important. But I think showing that you're showing up is really important, and a little humor can't hurt some hard conversations.
I know life gets busy, but I've noticed that you've missed the last couple of book clubs. Is everything okay?
That's great. I mean, this person noticed some changes in behavior, realized that their friend was withdrawing a little bit, and wanted to check in. And that's really the right thing to do. And I really applaud that person.
Okay, so a lot of these that we listened to were very funny, right? And like you said, does humor go a long way here at times?
It can, but I think we have to be careful how far we go with that humor, make sure we're not poking fun at the person's situation or what they're dealing with, right? We only can see surface level and there can be a lot going on. But I mean, using a little humor to start the conversation when it's appropriate and done in an appropriate way is a great way to get that conversation started. But I would just recommend asking the questions, being open to having the conversation, and recommending a path forward. You don't have to know all the answers to be a compassionate friend.
Good advice, Julie. Thank you so much for being with us.
Of course. Thank you for having me.